You're listening to Online Pet Health Webinar Podcasts with your host, Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealthwebinar.com.
Hey everyone, Dr. Megan Kelly here, and you're listening to the Veterinary Rehabilitation Podcast. Today I have got a chiropractor from Hermanus, which is in the Western Cape in South Africa. Karen Isted, she works on humans as well as animals, and I'm really looking forward to chatting to her today. And we're really going to focus on horses today. Welcome, Karen.
Hi, good morning.
Karen, thanks so much for coming on. I know you're really busy and you had to sort of squeeze this in your schedule. We've been struggling to find a time, so I'm glad that we got it worked out. Do you want to tell the listeners a little bit about yourself? I know that you do humans and you treat babies and pregnant women, and you've also treating animals. So just tell us a little about yourself and how you got into the animal side of things.
Hi, yes, yeah, thanks, Megan, first of all, for inviting me to come and talk here to you today. Very briefly, I grew up with horses from a very young age here in South Africa, completed my teaching qualifications on the equine side, completed the equine science qualification here in South Africa, and then went over to the UK, where I was lucky enough to end up on an Olympic competitive eventing yard. And there really was my first exposure to chiropractic. The yard at the time would get out their local chiropractor and their vet and their farrier on an almost weekly basis. And although it's now a couple of decades ago already, it was really my first exposure to integrative application of all these different modalities and how the individual specialists would work together and achieve really amazing results. You know, as a working rider, we would be the ones training these horses, and the difference once they've been through all those various sets of hands was just phenomenal. So yeah, from there I then retracked and I went back to university, trained as a chiropractor in the UK, spent a number of years working there, and then finally came back to South Africa about 4 or 5 years ago and set up practice here. So yeah, that's right. the long and the short of it.
So now your approach is very holistic, and you chatted now about all the different people that were treating these competitive horses. So what sort of professions would make up this multidisciplinary team that is addressing all the issues that these competitive horses have?
I think there's no hard and fast rule there. I think you've got your couple of pillars. Obviously, the vet is a very important one there, the farrier, and all of them ideally people knowledgeable in the bigger picture. In other words, people that understand the very, very important aspect of looking at the animal or the human. It doesn't matter whether we're talking humans or animals or horses or dogs. You've got to approach the whole, because we're all a sum of the component parts, and ultimately they talk to each other, these various parts. So unless you have specialists that understand the importance of that, you're going to run into trouble. Whether you have 1 or 2 or 7, everyone will bring their field of expertise, and as long as they talk to each other and work together, we're looking at vets, farriers, dentists, chiropractors, definitely, body workers, physiotherapists, hydrotherapy, all of those different modalities, nutritionists, trainers, very important, saddle fitters, very important. All those different things come into it. And the key there really is these individual humans' ability to understand their role within the whole.
Yeah, I mean, I think it's a problem just generally, if I think in the veterinary side of things. I remember when I opened up my practice, 2006, I had this dream of, a patient coming in the door and like a whole team of people, being at the first consult, and, we're coming up with a plan together and all working together. But obviously the practicality of that doesn't really work out so well because, first of all, there's obviously the expense, and to try and get everyone together in the same room with all their different schedules. But I especially think for the equines, maybe on the equine side of things, the team works a little bit better together. But for me, for the small animal side of things, I'll see the patient and then you'll refer them on. And I think sometimes, we really need to work together a little bit better, and find people that are in our area that complement what we do, but offer something different. And I used to have a very good working relationship with two chiropractors as well as a physio. We all used to really work together really, really well. And I must say the outcomes in my patients was so much better for it. So this is something that I'd really encourage vet rehab therapists to collaborate and to find people in your area that work with animals in different ways, and find out how you guys can support one another.
Yeah, absolutely. I think in some ways perhaps our neighbours overseas understand this concept a bit better. My time spent in the UK, nobody, certainly as a chiropractor, would willingly practice alone. You are just so much stronger when you're in a team, whether it's with one other chiropractor, or I was lucky enough to be with 9 other chiropractors. And we all had our different strengths, we had our different passions, our different approaches. There are 100 different techniques out there to use. And somehow you end up giving a service to the patient, again, whether it's equine or human, and they want to come back because they get results, they get helped. And it's the quickest way to get that patient back through the door is to actually help him properly and send him on his way, because he'll be back and he'll bring someone with them, So it's a good approach to practice, I think, personally. On the equine side here in South Africa, and even on the human side here, things are a bit different. We tend to be sole practitioners, and that's just a matter of time, I think. I think eventually all our professions will understand the synergy that we can create when we start working together. And not, I think also very important, when you find those individuals in your area, you need to sit down with them with a cup of coffee and discuss how you approach things, how they think, how they work. Because I think personally, and I'm talking just for myself, but personally, your greatest strength is realizing where your limitations are. I can do X amount with that spine. It will filter into the pole, most certainly, the jaw, most certainly. But once it's there, I can't fix the teeth. I will do the same with the limbs and the legs. But once the angle that's relevant is in the foot, I need that farrier to understand. And I also need the farrier to understand that maybe sometimes he's first. It's a primary hoof thing. Sometimes it's a primary sacroiliac thing. Sometimes the teeth are just so bad for the unfortunate horse that it's primarily a dentistry thing. But the dentist also needs to understand that they can make changes only as quick as what the rest of the horse can conform. Because after a while, you might have perfect teeth and a happy bit in the horse's mouth, but a sore back, because those angles filtered back through the spine, and at some point they end up jamming if we don't work together, and then you have a new problem. So it really is a collective approach.
Colin, I'd love to chat about, your view on horses that, if we look at a lame horse, we look at an unsound horse. And if I think about, I did some acupuncture on horses when I first started getting into rehab, and I can just remember seeing so many competitive horses that had a lot of asymmetry. Some of them weren't actually lame; they just were maybe you would call them maybe a bit unlevel. And I know that you have you have a description of how you differentiate all of those.
Yeah, absolutely. Again, it's very exciting to see these terms being bandied about. As a chiropractor, we've talked and we've almost, I want to be brazen enough to say, we've owned those terms for so long. They are bread and butter. But it's so exciting to see other areas beginning to acknowledge that there's subtle differences. The Royal Veterinarian College in the UK actually published a paper in 2017 where they said we strongly advise the need for redefining these terms. And and actually not using them interchangeably, because they aren't. Again, they're not cast in stone. This is my definition for them, and people will differ. But classically and traditionally, we would define lameness as a pain-generated problem. So traditionally, your vet would come along, he'd have a look at the horse. More often than not, that lameness would be located sort of knee level and below, because that's where the horse is most vulnerable. And 9 times out of 10, with good investigations, you can pain block that pain out. So if the horse is blocked, that pain will disappear and the horse will be able to be trotted up sound. So that's our classic definition for lameness, and that's unchanged. What we've seen over the years, and what people have come around to understand, is that a lame horse by definition is also unsound. He's unsound for the task at hand, and either you fix him or you retire him, but he can't continue the work he was meant to do. What we're finding is that there's a very, very big proportion of horses, and humans for that matter, that are unsound, but they're not lame. So in other words, they may or may not have pain. My humans can tell me, I don't have pain, but I'm just not right. I don't have pain. I'm still cycling, running, playing, doing whatever I want, but I'm not right. And the horses will, the owners or the riders will say, my horse is fine. It's eating, it's healthy. The vet's checked it. The teeth are fine. The feet are fine, but it's not holding the canter. It's not picking up the lead. It's tripping, it's dropping a leg when jumping, it's cold backed, all of those things. And 10-20 minutes into a warm-up, they'll be fine. Now, at some levels, that's all right. But at some levels, especially when we start looking at the competitive horses, that's not ideal. And that's where the unlevelness will come in. Very clearly seen in a horse that's not tracking up equally, especially at the walk. And also, if you start looking at the right anatomical markers, you'll start seeing that there's, without fail, there is a SI joint, a sacroiliac joint, that's sitting slightly lower, and because of that, you've got a corresponding hip that's sitting slightly lower than the opposite side. And then I can extrapolate, because that will cross to the front 4 on the diagonal. And then you can go further and you'll find that that horse has got a grazing leg on that very same diagonal front. And those heels are lower and that toe is longer. And all of those problems, in my opinion, come back to the pelvis, because I'm a chiropractor and that's where I would start. But it doesn't really matter whether you look at it from the foot or the pelvis or wherever. It matters that you look at the whole. And so that's where we start bringing unlevelness or asymmetry. Those two terms are interchangeable, and you begin to classify it as something separate from lameness, because there is, as far as we can see, not really always pain. Of course, the horses can't talk to us, but it doesn't have to have pain, and you can't pain block it out.
On those sacroiliac joint cases that you have, what is your approach to treating them?
All right. Once again, remember, I'm talking from a chiropractic biomechanical point of view. People traditionally talk about us as bone men and women, and we move and shift bones. And although they can be forgiven for saying that, because it is what we do, it's not the point of what we do. The point is changing that mechanoreceptor that runs in the nerve that runs in that joint. Every joint in the body, regardless of the species, has got a nerve running through it, more than one often. And those nerves have got mechanoreceptors that pick up movement and nociceptors that pick up pain. And in a grossly simplified manner, they can be seen as a seesaw. So if you stimulate the mechanoreceptor, you downplay the nociceptor. In other words, if you move the joint, the pain gets less. We know that because when you bump your elbow, you end up rubbing it. You end up moving it to nullify the pain. And so that's really the principle. As a chiropractor, I go in, I assess, I look at which SI joint is the problematic one. It's often the one that's sitting slightly lower. And I put an adjustment through it, through the SI joint, through the hip, standard procedure, because you need to do both of them on the ipsilateral side. And then we reassess the movement. Often that's enough. From a chiropractic point of view, there's always muscular work that needs to follow up, and almost always farrier work that needs to come. But purely from making that SI joint function better, it involves a selection of adjustments through the SI joint, the lumbosacral joints, the hip joint, and then in the horses, quite often, the thoracolumbar joint, which is where the saddle stops usually, and the rider's weight is most of a problem. Does that answer your question?
Yes. So then how often do you find saddles a problem? I know that saddle fitting is quite a big thing, and you can't just put one saddle that fits one horse onto another one.
Yeah, saddle fitting is a very contentious point from the point of view that it is so easy to do, and there's such clear guidelines, but it's still so easy to get it wrong, So it's a very important person to have in your world if you own horses, and to really look for one that really does know what they're talking about. And even then, you've got to remember you're working with a human, there's human error, and sometimes they get it right, sometimes they get it wrong. But that the saddle plays a role is undeniable. And the saddle will play a role. The saddle needs to be fitted carefully for the individual horse by really an expert in that field, not just a shop assistant, someone that's had some qualification, that's validated and recognized. And usually those people are around. They usually very happy to travel because they're plying their trade like that, and they're proud of their trade, and they should be, because it's very skilled. But then it doesn't stop there. It's no good having a saddle fit perfectly with the rider sitting still. We're then also dealing with riders that don't, no matter how experienced they are, you don't always land perfectly in that saddle. You're knocked about and you land hard because the horse has taken off wrong from the jump, or the horse has stumbled, or whatever. And the minute that bum of the rider knocks that saddle hard enough, unexpectedly, you are going to have a mechanical issue on that vertebra and that muscle underneath that saddle. And if we're lucky, and if the horse is in a good yard where these things are picked up and looked at instantly, they dealt with, they treated. 2 days later, the horse is fine. And where it's not, that problem, that one vertebra that might got knocked a bit slightly out of alignment, will have a ripple effect, both caudally and cranially. Both to both ends, there will be ripple effects. So get a good saddle fitter.
I've seen a video actually recently on social media. It showed sort of the stress on a horse's back when somebody climbs on using the stirrup to get themselves up from the floor, and not actually using a box or something. What is your feeling about that? So, I mean, should we be getting onto horses standing on something to get on to minimize strain on their back from putting your foot in the stirrup? Especially I think with adults, children are obviously a lot lighter for them to get on, but if you're slightly heavier, that must have quite a lot of tension and torque on the back.
Yeah. I think the short answer there is absolutely. The long answer is, adults, of course, you've got 60 Ks plus that is hanging onto that saddle, and even if you're mounting lightly, you're still starting on one side and you're ending up in the middle. If you continuously do that from the left side, as we traditionally are trained to do, you will have a problem. And we see it because the amount of horses where owners will say to me, watch out, she's going to bite when you touch the girth area, or they'll nip, or they'll kick. They've got a sternal fixation. You go to underneath that girth, trying to avoid the teeth whilst you do it, and you assess the sternal and ribcage position, and 9.5 times out of 10, it's deviated to the left, because the girth gets pulled up on the left, and then the saddle gets yanked down to the left as the weight of the rider gets put in the stirrup, and then the rider is on and off they go. But you do that continuously with horses in care, you will end up with mechanical problems in them. And then you mentioned the kids. On the one hand, I want to say I'm a big traditionalist. I like being able to mount without finding that I'm getting older, it's getting harder and harder. for me. So on the one hand, it's very important for us to stay supple. You know, we also have a set and an SI joint and all sorts of mechanical things to look after. But you know, the little ones, I've got little ones now, and they're just not strong enough. So they end up getting their foot in the stirrup, and then they literally claw their way up the saddle until they're on top, you know. And even that, you know, you've got 10 or 15 or 20 kgs hanging on to that saddle on the left until they're in. Sooner or later, you're going to have problems.
Yeah, no, for sure. My girls also ride, and my eldest, you know, her Hannah, she's quite tall, so she's actually able to stand now and put her foot in the stirrup and get up. But she struggles. You're right. She struggles to actually push off, and she doesn't have the arm strength to pull herself up. So I give her a leg
Absolutely.
up now still. So
yeah, no. There just sorry, one last thing to add there. On that note, it's very important, even when you mount with a mounting block and when you lead the horse, is that you and the horse learn to be doing that from the right and the left. You know, we have motor patterns, and it somehow just feels strange to lead the horse on your right, on your left. But the horse must learn to be led from his right, and you need to get used to that. And the same goes for mounting and dismounting. It's all about balance for everyone.
Yeah, otherwise you end up with problems. I mean, I think about myself. I was a rider, and we were taught always you only do it on the left. You lead on the left and you get on the left. You know, so but it makes complete sense what you're saying, and you know, rules are there to be changed, aren't they?
Well, that rule stems from the 1700s when the swords were carried on the rider's left. So you know. Yeah, I mean, I think
is that the reason?
There a little. Yeah.
Is that the reason? Oh, wow.
Most men would be right-handed, therefore the saber or sword or whatever would be on the left hip. They would then not be able, the horse would have to be on the right. So they would lead from the left in order not to interfere with on the left.
That's so interesting. I never knew that.
On from them.
Yeah. Let's talk about the TMJ joint, because that's something that comes up in quite a lot of your patients, doesn't it?
Yeah, and it also, much like the SI joint, it's something that various modalities, various specialists have realized it really is a critical point, again, across species. So humans, horses, dogs, doesn't matter. It's a very important area.
And
go
ahead. Go ahead. No, you go.
There's so much I could say, but I think the important thing to understand, or the foundation of the TMJ, is to see it once again as a fulcrum or a part of the whole. So the TMJ obviously connects the jaw or the mandible, and it then communicates with the occiput, which is one of the posterior skull bones, which then leads into the atlas, being the first vertebra. And so it's your junction, it's your bridge. You have any dental work, any chewing, any feeding, any bitting problem, it will impact on that lower jaw, it will translate through the TMJ and move into the spine. And you can argue that both ways, because anything that makes its way up into the spine, from the hooves up, will translate into the pole, down into the jaw, into the teeth. I attended a neurodynamic dentistry workshop a couple of months ago here in South Africa from an American equine dentist that came out and gave the talk. And she was saying, sooner or later, no matter what went wrong with this horse, viscerally, mechanically, emotionally, sooner or later they see it in the teeth. And she was so right, because sooner or later everything is seen everywhere. The body communicates with itself. The TMJ then, of course, very important from a teeth, mandible, face point of view, but not to be forgotten, it's massively important with headaches in humans and with horses. Horses also get headaches. Your your headband sits behind the ears of the horse. So the bridle piece that sits right behind the ears sits right across the pole, in other words, the first cervical vertebra, and it runs down from there into cheek pieces, which runs over the TMJ with buckles and straps, and people sometimes tie these too tightly, and you've got the whole nervous system, the whole trigeminal nervous cranial nerve system running here, amongst other things. And it's just a neurological hotspot. So there's so many different reasons we can affect the TMJ for the worse that we need to be aware of.
And do you find that incorrect bits can have an influence on malalignment in the TMJ?
Yeah, I think incorrectly. In other words, it might or might not be the cause, but if it's sitting in the wrong place on the mouth, it definitely will affect the teeth. Interestingly, this dentist whose workshop I attended said a correctly fitted bit does not impact on the teeth at all. And I think that's important to register as well. You know, actually having a bridle that fits properly. And, you know, this is sort of riding club stuff for all of us that came through the ranks. But the amount of people that might join horse riding later in life that missed riding school clubs and things, for better or for worse, nobody teaches you these things. Nobody. So unless you actually make it your responsibility to go to someone in the know and say, you know, do you know, how does a cheek piece, a brow band piece, a throat latch, how do I measure to make sure my bridle doesn't just look good, but it actually does what it's meant to do? Nose bands is a evil. They're very, very useful when they fit correctly and they're necessary. But it's easy to get them wrong.
Yeah, I mean, I've seen many people with really tight nose bands, like really, really tight, like you can barely get a finger in, and that obviously has an impact in the rest of the body. Corinne, it's so interesting everything you're talking about, and I know that this is something that you are really, really passionate about. So much so, you've actually created like a 3-day workshop on all of this, haven't you?
Yeah, we're pioneering a workshop here in the Overberg in the Yammer and Otter Valley through Equicanus, that is owned and run by Joe Smith here in the Yammer and Otter Valley. And really, we're very excited. We're using it as a bit of a springboard to see where it's going to take us. You know, none of what we talked about this morning even is owned by me at all, or even I can't even claim any ownership to it. It's broader, bigger ideas that have been around for centuries, and we just need to rediscover them. We need to rediscover their importance in how they function, again, cross species. And so, yeah, we've got together, we collaborated with, we've got a very, very knowledgeable vet in the area, Dr. Mark Walton. We've collaborated with a good farrier, the dentist I mentioned. And so we just starting to pull it together, all these specialists, and say, let's put it on paper. Let's start teaching people the importance of not wasting time and money trying to fix something with one thing. Let's rather pull in everything and see where it takes us.
Yeah, I think it's great. So for those of you that are in South Africa, I will put the link into the podcast notes where you can register for the workshop. For those of you international listeners, maybe it's time to come and visit Hermanus in the Western Cape in South Africa if you'd like to attend. You guys can also just follow that link. Yeah, I'm really looking forward to seeing how it goes. And I mean, if I just think about, you know, before I sort of got my team together, you know, in the days where I was a sole practitioner, you just have those cases that you just never ever seem to resolve their issues. Yes. And, you know, when you chat about this team, it really makes me excited. And it makes me think, you know, we're just getting all that information together and tying it together, because at the moment, I think it's just very bitty. You know, you hear a little bit of something, but once you actually can sit down and every single person from every angle, it really will just consolidate everything for the therapist. You'll just sit there and you'll go, okay, and like this ties everything together and just give you such a better understanding. So I think it's going to be great.
I think it's both sides of the coin is so important there, because on the therapist clinical side, we need to understand what the other people are bringing for the patient, but also from the owner's point of view. Sometimes we're just overwhelmed by people claiming, oh, I'll come fix this and fix that, and your problem will be solved. And the amount of owners I get coming to me saying, I've been to this and this and this and this and this person, and my horse is still unsound, or it's still doing this, still bucking, it's still doing whatever. I think as owners, we need to understand that the buck stops with us. We've bought this horse, or we own this horse, or we've inherited it, or whatever, and we need to be part of that decision-making process where we say, okay, I hear what this person says, I acknowledge their knowledge and their expertise, but what about this and what about this? So it's about empowering our owners as well to understand really the responsibility they've taken in having this animal.
Yeah, and also it's just that it isn't going to be one thing that's going to fix their horse or their dog, or and there's also going to be things that they're going to need to do from their side. So things that we're going to ask of them. So I think this is maybe for another conversation, because I think it's a challenge for all vet rehab therapists to try and get those owners to comply with us. And even sometimes when we have a plan, they see that shiny little object. Somebody says, oh, I got so-and-so and completely fixed my horse. And then they're like, off the plan, and they're following the shiny object, hoping that, this is going to be the thing that's going to sort them out, and not actually putting the work in and doing the hard yards.
Absolutely. I mean, I think that the two areas we neglected slightly this morning is the role that the trainer plays, because that's the long term, the rehab. After we find the problem and we've leveled the horse, or we've stopped the pain or whatever, fitted the saddle, now the work starts. Now the work starts between the rider and the trainer. And on the one hand, the trainer was slightly neglected this morning. They play a pivotal role. And of course, we haven't touched even on the biomechanics of the rider. And that's a whole new dynamic. Definitely a conversation for another day, but pivotally important in achieving your goals.
Let's have that as another podcast interview. I think that sounds very interesting. Corinne, thank you so much. Those of you that are listening, this is actually such a brilliant podcast that leads up to our very first webinar that we will be doing for our equine platform. So we will be launching the equine platform in March, and on the 6th of March, we will be giving away a free webinar. So Marinette Teeling will be lecturing this, and it's on lameness indicators. So have a look in the notes. If you're interested in it, you can register for free, and really ties in very well with what Corinne has said. And for those of you that are interested in the course, I'll also obviously put those details to register for Corinne's course. Corinne, thank you so much, and I'm looking forward to having you back on the podcast. I think that we've sort of opened a whole lot of things now, and we've got lots of things we still need to talk about.
Absolutely, but thank you for the invite. It was nice to share with you this morning, and again, just start these conversations, because that's where the change begins.
Thanks, Corinne. Have an awesome day.
Same to you, Megan. Bye.
Bye-bye. For more information on continuing education opportunities for veterinary rehabilitation therapists, please go to www.onlinepethealthwebinar.com. Thanks for listening, and don't forget to subscribe to my podcast so you don't miss out. I'm Dr. Megan Kelly on the Veterinary Rehabilitation Podcast. Bye for now.